Thank you to Liz and WKRC. Okay, let's bring in Dr. Dena Grayson, our pandemic expert. She's always great to have you back, Dr. Dena. So what we wanted to talk to you about a little bit was what groups should and should not be getting this vaccine. I mean, there's some question whether or not if you are pregnant or want to become pregnant, maybe you shouldn't get the vaccination. Your thoughts?
Sure, Eric. Well, certainly the highest risk groups and the people that should be in the front of the line to get the vaccine are frontline healthcare workers and people who are residents of long-term care facilities, such as nursing homes. In addition, states are also starting to vaccinate people who are over the age of 65 and people who are under the age of 65, between the ages of 16 and 64, who have, risk factors for serious COVID-19 or even potentially death. Now, some of the other workers that are also being vaccinated are frontline workers, not necessarily healthcare workers, but frontline essential workers, people that are working in the post office, people that are working in education, such as teachers and administrators and other essential workers. Now, Eric, with respect to pregnant women or women who are planning to get pregnant, we don't have all the data yet. So there's only some data that are available from some animal models. That's with Moderna's vaccine. Didn't show any real risk, but there are no clinical data as yet. So those studies are planned. Studies are planned in pregnant women. However, there were a handful of women who did get pregnant during these large clinical trials of Pfizer's and Moderna's vaccines. And the companies are analyzing those data. Thus far, things look good, but it's only in a small number of pregnant women. So the bottom line is, for women who are pregnant or are planning to get pregnant, this is really an individual decision. We don't anticipate that there will be risks with an mRNA-based vaccine, such as Pfizer's or Moderna's, but we don't have the data yet. So if you are someone who is a frontline healthcare worker at high risk of getting COVID and you're pregnant or planning to get pregnant, certainly that would lean you towards getting the vaccine, but this is an individual decision for each woman with her doctor.
Doctor, there are America is hooked on drugs. Prescriptive drugs are things that help your blood pressure, raise it, to lower it, to do everything. Are there any interactions with people who are taking certain drugs? Do we know any conflicting interactions, anything that would cause a problem?
Yeah, there's really not a risk for an interaction with the medications because these are very different types of products. So the medications work very differently than this vaccine, which works using messenger RNA, mRNA. So really there's no worry for what we call a drug-drug interaction. And in fact, people who have underlying cardiovascular disease and are taking blood pressure medicines are at higher risk for serious COVID-19 or even death. So those are folks, again, that you would want to get earlier in the line to get vaccinated.
Very quickly, only about a half a minute or so, Dr. Dena, the new Pfizer drug, the one that is said to be coming out soon or approved soon, may have some sort of prophylactic effect. In other words, not only will help you with the symptoms, it may actually help you not spread it to someone else. Your thoughts?
Well, I think you're referring to the vaccine. I'm not familiar with the drug you're talking about, Eric, as yet. I will say with the vaccines right now, we're waiting data to see if they reduce the risk of spread to others. We don't know that yet. That's why even if and when you get vaccinated, strong advice is please wear a mask. My prediction is that these vaccines will decrease the risk of people spreading the virus to others, but we're still awaiting the data.
All right, going to leave it right there, Dr. Dena Grayson. Always great having you on. Thank you.
Thanks for having me, Eric.